Here's the biggest thing to worry about with coronavirus. The ability of the American health care system to absorb a shock, what experts call surge capacity, is much weaker than many believe. A crucial thing to understand about the coronavirus threat, and it's playing out grimly in Italy, is the difference between the total number of people who might get sick and the number who might get sick at the same time. America has only 2.8 hospital beds per 1,000 people. That's fewer than in Italy 3.2, China 4.3, and South Korea 12.3, all of which have had struggles. It's estimated that we have about 45,000 intensive care unit beds in the United States. In a moderate outbreak, about 200,000 Americans would need one. With COVID-19 cases on the rise, some hospitals are already running low on protective equipment for staff members, as they navigate shifting guidance on treatment protocol. Hospitals don't survive financially in the United States by keeping beds open and equipment idle. They have enough equipment to be cost-effective, but still retain capacity to care for extra people in emergencies. Moreover, if a pandemic more closely followed the model of the Spanish flu outbreak of 1918, we would need more than 740,000 ventilators. Many people are comparing this virus to the flu. The thing to remember, though, is that the influenza numbers are spread out over 8 months or more. They don't increase exponentially over the course of weeks, as the cases of COVID-19 are doing right now. Further, a greater proportion of people who are becoming ill now are seriously sick. According to some estimates, 10% to 20% of those who are infected may require hospitalization. Many health experts expect that a majority of people will eventually be exposed to, if not infected with, this virus. The total number of infected people isn't what scares many epidemiologists. It's how many are infected at the same time. An unchecked pandemic will lead to an ever-quickening rate of infection. If, however, we engage in social distancing, proper quarantining and proper hygiene, we can slow the rate of spread. And make sure there are enough resources to properly care for everyone. This can also buy us time for a vaccine to be developed. South Korea has flattened its curve by engaging in extreme testing and social distancing. It has set up drive-through screening stations so people can check if they're infected without putting others at risk.